day 5 after my rhinoplasty. Today the bruising and swelling is really starting to reduce. So you can see under my eyes there is only a slight kind of darkness and none of the harsh lines that were visible earlier. Additionally, the swelling on the very tip has started to go down, and on the nostrils as well, and a little bit on the sort of nose bridge between the two eyes, but that's a lesser effect. The main symptoms of discomfort I have at the moment is a slight headache just above my brow line here, although this could indeed be unrelated. As for the pain in the nose, it's completely non-existent, and today some of the largest scabs from the first couple of days of bleeding started to come out during the cleaning process. So that was a huge improvement in the comfort. Although I wasn't aware this was causing a problem, my breathing is much better. I can take in full breaths, although it's still slightly congested, but vastly superior, and obviously the hard scabs are no longer discomforting me at all, and they continue to come out. So if that process continues, I'm sure I'll have a very clear feeling nose very, very quickly. I do have some throbbing sensations on my nose, sort of a pulsating discomfort. It wouldn't quite bridge on pain, it's just a kind of, I guess, a healing sensation, and it's not too hard to manage at all. The other side is I'm definitely starting to get some sensation back into the tip, so I've, by accident, touched it a few times, sort of when I wake up in the morning and I'm just coming to, and it doesn't hurt so much, and on top of that I can feel the touch and sensation, which is very positive. I'm starting to gain a lot of movement in my upper lip back, although it's not fully back to what it used to be because I'm still constricted, partly by this cast. I can see that as the healing process takes effect around my nostrils, I am capable of better diction, I'm capable of moving my mouth in a much more fluid way, which is improving my comfort. I am having some pain above my front incisors on the gum, sort of just below where this line would be. Almost as if my teeth have some pressure pushing down on them. I'm not entirely sure if it's unrelated, but it's a little bit discomforting. But again, not much to worry about. I decided not to take my diazepam or cocodamol tonight on the basis that I don't feel I need them. And the other nights were cautioning to get a better sleep, but since I am now breathing much better, I don't think it will be necessary. The itching is still continuing, which is irritating, but manageable as well. I do have the urge to scratch, but obviously I absolutely can't. And the cleaning process is starting to become a lot easier to do. I'm not removing nearly as much sort of blood and mucus as much as just mucus, and I apologise for the graphic detail, but now the mucus that I do remove is very clear, it's very normal looking, whereas before it was diluted with a little bit of blood and a lot of dry debris. Other than that, I had my first more solid meal today, although I think this is my personal preference to not have to chew so much, but it was not too difficult to eat a hamburger, which may seem trivial, but to me that was a minor accomplishment. As for the bruising on my cheeks, that's come down a lot. And as for the actual size of my nose, I'm now very anxious to see. I can't determine much through the cast, so I have to really wait and see what the actual total effect is. I have noticed a lot more symmetry on the bottom of my nose. This wasn't something that particularly concerned me before surgery, but I'm glad to see that it's improved nevertheless. I also had a small lesion removed on the left hand of my, left side of my nose. This was very particular to my operation, but this has also caused no discomfort, and there's a small scab there, which I think will fade away to leave a tiny mark, which is vastly superior to the issue I did have prior to surgery. I've been taking my medications as prescribed, and I'm very, very pleased with the progress so far. Hopefully the throbbing sensations will start to dissipate and the swelling will continue to reduce. Thank you.